Button. Welcome, Joel. It's a pleasure to have you with us on this Zoom call with you on the West Coast and me on the East Coast. The world of Zoom has changed a lot. How are you?
I'm good, Ted, and I appreciate the invitation to talk about development and consultation psychiatry in general, and of course, to be talking with you in particular is a lot of fun.
Well, our paths first crossed about 45 years ago when I was starting out in my residency. Time flies.
Yeah, it seems like yesterday. I was always drawn to, I think, the emergency room and the consultation psychiatry. And those are the parts of my residency that I remember most vividly, and where I continued to hang out professionally for much of my career.
So when you were doing your training and getting interested in consultation and hospital-related work, how did you first hear about the APM, as it was then called? Now it's called the Academy of Consultation-Liaison Psychiatry.
Interesting question. I think I need to go on a little bit of a tangent. I was always very passionately interested in research in psychiatry. And I think when I came to Boston, I was a little more drawn to vast social questions and psychiatry. My early work in the Holocaust certainly comes from that perspective. When I started doing CL at the General, I got very interested in questions about the physiology of stress and what that did to illness and coping behavior. And that's been the principal focus of my research for all of my life. I didn't see myself necessarily as running a consultation psychiatry service in the early days, and wasn't, as a result, wasn't very active in the APM in the early days. That changed as I prepared to leave Boston and move to the University of California, San Diego. I was recruited to carry on my research and to take over the consultation liaison psychiatry service. And I realized that I needed a primer in how to do things. I, of course, observed very closely how Tom and Ned had structured the service in our days of residency.
So you're talking about Tom Hackett and Ned Kassim.
Yeah, but I had not done a CL fellowship, and I had been doing basically bench work for a couple of years after my residency. I was playing with monkeys out at the primate center, looking at stress and cholesterol metabolism. Then I was playing with my colleagues, you included, in studies of catecholamine release and public speaking, and you and Jerry Rosenbaum and a lot of other people kindly participated in these studies. But
I remember getting my blood drawn by you every 3 minutes during those public speaking episodes.
Yeah, but I hadn't thought about the complexities of running a CL service until this job was looming in San Diego. And I had about a year's lead time before I left Boston to do that. And I think it was Ned Cassim who suggested that I might want to go to some of the APM meetings, see how it was structured. It's interesting. I've been very active in the APA and in the American Psychosomatic Society. And the APM, I'd say, went through just an enormous change, maybe around, let me think, 1975, 76, 77. And at that time, it became a much more interesting society. The journal before Tom Weiss took over was a little kind of throwaway journal that almost seemed like a drug advertisement journal, and it wasn't interesting to me. But when Tom took over and management of the journal and ownership of the journal changed, it began to be much more interesting. The meeting also over the years has changed enormously. It used to be a ghetto for old people from Bosnia-Wash. And there was no diversity, very few women, very few geographic diversity as well. And over the years, the academy has just blossomed. It's gotten to be much younger and very diverse. CL psychiatry has gotten to be a very popular direction for young psychiatrists. And I think the academy has just done a remarkable labor in supporting this. I found that the academy's emphasis on education was particularly valuable. How to give a workshop, how to give lectures in preparation for death and dying, difficult conversations. There are a number of these sorts of things that have been on the annual meeting that have been just very valuable. And I think the how to organize a service, all of these things were very valuable and remain valuable. I think the maybe the last 10 years, I think the research emphasis has gotten much stronger as well in the academy, and that's been a welcome development as well. I'll pause and see if there are some other questions.
Sure. So about how many meetings have you attended in your career?
Of the academy?
Yeah.
Ooh. I don't know.
When did you first start, and how regularly do you attend?
I would say I have been attending once every 2 or 3 years. I frankly can't remember the first meeting I went to. I just can't. I was anticipating you were going to ask me that question. I liked the way that the meetings were structured. They were very friendly. There was a there was a welcoming quality and informality to the meeting, which I thought was terrific as well. I guess when I got active in, I sent my fellows to the academy meetings and would go with them. So I have a feeling that maybe I started going after I moved here to San Diego in 1985. So I can't recall, however, many, oh yes, that meeting in particular. I don't have that sense for it. I think the fellows immediately valued the academy. The status of CL psychiatry is quite complex in academic psychiatry per se. There's certain areas, certain institutions, Mass General, Mayo's, Sloan Kettering, where CL psychiatry is recognized as an absolute core function of psychiatry. But for many other academic departments, CL psychiatry has not been emphasized and is still not emphasized. It's not the moneymaker that inpatient psychiatry is. It doesn't. So it's kind of a lost leader in many psychiatry programs, despite its vitally important contribution. And I think that for that reason, going to a meeting filled with CL psychiatrists who are interested in common issues, face common issues, is very important for the nurturance of young CL psychiatrists and the formation of their identity. Of course, as we get older, we go because we like to see our old friends, and that's certainly one of the major incentives for older people going to meetings. As I think about the early days of the field, there were these struggles between the MGH view and the Mount Sinai view of CL psychiatry. And it took us a while to get to the point where we could acknowledge that both views were important, that consultation at its heart involved a specific consultation, but that to have those consultations sought and listened to required a pretty substantial liaison and working with relationship with other specialties. And I think in the early 70s, maybe throughout the 70s, that issue troubled the field as we tried to come to terms with it. But there was, fortunately, some support from NIH for consultation psychiatry. Jim Eaton sent a lot of deeply appreciated funds to set up CL programs around the country. And I don't even know where the people remember him anymore. But that was a special time that helped the field get started. And interestingly and sadly, that might have been the high watermark for funding from NIMH for CL psychiatry.
So that was one of the great impetus for growth of the field in the 1970s and early 80s. Over the last 10 to 15 years, what do you think the driving forces have been that has given membership in the Academy legs and has grown to a membership of close to 2,000?
I think um, I think a couple things. The journal in your hands has gotten to be a exciting journal that's interesting to read, that is a mixture of cases, and people poo-poo case studies, and I think that's a very dangerous disrespect of something vital in medicine. Medicine and research at its core is still a letter from me to you. I saw this unusual thing, and this is what I think is going on. Have you seen that also? And that's one of the strong things in the journal. And the journal also, of course, has larger clinical studies as well. So I think the journal has been a terrific journal that has been focused on the practical issues that we see as consultation psychiatrists. Secondly, I think the whole collaborative care, Wayne Caton, University of Washington approach has been recognized as very timely, very important. I think there have also been some other areas that have helped the field. I think the Academy has very patiently worked towards strengthening the fellowship programs in consultation psychiatry. And that allows people extra training time to develop expertise. So all of these things have been enormously important in the growth of the field. I think also CL has had a stronger relationship with the APA itself. Again, I don't know how many people share my view, but the APA and largely organizational psychiatry itself has been focused on issues of psychoanalysis, inpatient psychiatry, intensive outpatient psychiatry, psychopharmacology, but has not been all that interested in CL. And I think Tom Weiss did a lot to help get the APA more involved in this. I think the APA has changed over the years. I mean, it's just phenomenal to me to look back and see what was the direction of the field when we were residents in the 1970s. So I think the APA has been more supportive of consultation psychiatry. And some of that may also reflect the APA's increasing medical model. And certainly when you talk about medical model, good Lord, that's something that we've always espoused. Consultation psychiatry is just this rich amalgam of medical model, social model, and personality theory. And that's what I find so richly, deeply gratifying about the field. And I worry that we may lose that. I worry that the field may revert to one-dimensional view. I mean, collaborative care, as much as we all love it and respect it, collaborative care has to remember that consultation psychiatrists have a deep appreciation for the vicissitudes and vagaries of personality and interactions and personality. And that maybe doesn't fit on a computer screen very, very comfortably. And I think that's one of those things that we have to look out for as we think about the field in the future.
So if you look into your crystal ball and try to predict where consult psychiatry will evolve into over the next decade, how do you think it looks?
I'm not sure, Ted. The ability to keep juggling all these balls in the air at once, it's enormously gratifying to do, and it's enormously challenging. We're all like the flying Wallendas. Yeah. And actually, there was an obituary in today's paper about yet another Wallenda dropped dead. It takes true acrobatic grace to juggle all these things. And I think the field will flourish only if it's able to continue juggling. And that's going to be ferociously difficult with the funding climate. NIH has frankly never been supportive of consultation psychiatry. NIMH, I should say. NIMH has focused on other areas. Many of us who do research in consultation psychiatry have gotten our funding from other institutes. The research funding for CL has always been challenging, and I think that will just become more so.
Any suggestions for how the Academy and its membership or leadership can help us adapt to the juggling future that we have in front of us? How should we prepare each other for what might lie ahead?
Let me work into that in the direction of low-hanging fruit. We do a good job of encouraging our mentees and our young colleagues to publish and to present at national meetings. But, the hard edges of research, I think we could do more. We could have workshops on the technology of doing a meta-analysis. I've written hundreds upon hundreds of papers, and empirical papers are very easy to write. They write themselves because
for you, not for everyone.
Well, they write themselves. They have a structure. Reviews are horribly difficult to write, and in academic parlance, in today's academic parlance, meta-analyses get more respect than old-fashioned narrative reviews, even though the old-fashioned narrative reviews can also be very valuable. Regardless of the value of one versus the other, in terms of academic credentials, well-written meta-analyses get vastly more respect. And certainly we could have a much more of an emphasis on how to do meta-analyses, workshops. I think statistics is similarly something that needs more attention. And that's probably best done, I think, as workshops rather than journal articles. The clinical trial design. I think one of the things that has never happened, despite a lot of effort on a lot of people's part, is that the Academy, the Consultation-Liaison Academy, and the American Psychosomatic Society have just not worked as well together as they might. The APS is almost the mirror image of the Academy in its interests. They're still oriented towards important common ground. APS is almost exclusively research oriented and very little pragmatic clinical aspect. I think that both societies would be richer if they somehow worked together better. And I'm not sure how that would happen. And a lot of people have pushed for it over the years. I think there's the nice thing is that the academies are no longer against each other. It used to be you were one or the other, and it was just stupid the way it was set up. Now they've just kind of individuated and they go their own ways. They're amicable, but I don't think they interact as much as they could or should. One of the things that I think has been a total failure in consultation psychiatry is our inability to get multi-center clinical trials done. Just not happening. I'm sure you and I can scratch our heads and point to some exceptions, but it's a vast pity. And the Academy would be in a natural position to try to foster that. For a number of years, I ran the psychosocial oncology program at our cancer center. And, in cancer centers, there are multi-center networks that are set up everywhere, so that the network is already set up. The administrative issues are already set up. The IRB, how to metabolize the money, all of those things are already set up so that they can take advantage of a new development or scrutinize a new disease. We haven't been able to do that in CL psychiatry very well, and takes a lot of work and a lot of bruising, takes a lot of politics, careful politics, diplomacy, because otherwise it tends to be bruising and people are antagonistic. It would be a very good thing if the Academy could foster that. And I suspect the American Psychosomatic Society would probably be interested in trying to help as well. But
well, as a prolific author and a longtime journal editor and a winner of the Hackett Award, how do you think younger members of the Academy can best build their careers and use the Academy to do so?
My dog is looks like protecting me from the evil letter carrier. So you'll hear from her as she muses about how to answer that question as well. Excuse me for 1 minute. Ollie, stop. Molly?
Just like consultation psychiatry, always something unexpected.
Well, yeah. And she's still scrutinizing things, triaging the mail here for me. So would you would you mind repeating the question?
So I was commenting that you're a prolific author and a longtime editor. And from that perspective, how can you make suggestions for our younger members for how they can build on their experience with the help of the Academy?
I think the mentoring function of the Academy is really important. When you start going to a meeting, you should, particularly a meeting in your own guild, and look, we're a guild in consultation psychiatry. Young members should attend the Academy regularly. Maybe that doesn't mean not every year, but certainly every other year, because you'll meet colleagues, you'll learn from colleagues, you'll get career guidance, hearing what goes right and what goes wrong in other centers. Some of those things will be formally discussed on the program, and many of them will be talked about at the bar or over dinner. Secondly, it's very important to write. I think one of the problems in CL psychiatry is that we love our work so much. We're so enchanted and by the complexity of seeing the patients. There are so many patients. And some people just put aside the importance of writing and they don't get there. And I think mentorship can help them with that. When you write, you'll be rejected. You just have to get used to that. And some people are afraid of rejection. I think encouraging people to write is always going to be important because it's the ultimate way of teaching colleagues what's going on in the field. Other than that, I think that the career issues of a consultation psychiatrist are the same as a geropsychiatrist or a dermatologist. There's certain things that we all learn to do. We learn that if you snipe a lot, if you're negative a lot, if you gossip a lot, people will see you that way. And I think being positive and not gossiping is helpful for people. I think finding somebody who you like and work with well, and then nurturing that relationship is really important. Look, there are lots of colleagues out there, and some relationships work and some don't. Life is too short to collaborate with somebody who you just don't get along well with. On the other hand, when you work well with somebody, you've got to continue nourishing that person, supporting that person, and vice versa. I think that support is conveyed by tangible fiscal support when you're high enough administratively to send some resources to somebody. The support is also conveyed by authorship, including people on papers and even putting them first. Tom Hackett used to do that very well. I mean, he would get his residents would write a paper and he'd make sure they were the first author on the paper. And I think many of us do that to this day. So lots of ways of nourishing somebody.
Who would you put on your list of mentors?
Chet Pierce at Mass General was wonderful. Chester Pierce, he had a breadth of approach to psychiatry and a life experience that was just terrific. And he was a supervisor of mine as a resident for a couple of years, and it was so helpful that I, when I started getting NIH grants, I included him on my grants as a co-investigator because he was just so helpful. So I learned an enormous amount from him. Before Boston, I was at Stanford Medical School and worked a lot with David Hamburg, who many people may not remember him at this point, but he was the head of the Institute of Medicine, head of the Carnegie Corporation, just encyclopedic knowledge. I worked closely with Tom. I think Tom was supportive. Fred Guggenheim was supportive. John Boris, Ned Kassem. It was a pretty supportive place, and one needs that as one develops in a career. And I think particularly if you're in a department that doesn't have a big CL program, you've got to go find your people elsewhere, and that usually means in professional societies. So I think the Consultation-Liaison Society is going to play a vital role for those people. You know, in big departments with a CL emphasis, there's a lot of, you know, we understand each other and we support each other, but it's a different world when there are just kind of Noah's Ark approach. Well, there are two animals of each species, and so there'll be two CL psychiatrists, and that's it.
Joel, anything else you'd like to tell our viewers?
You're not going to know where the field is going to go. When I started out, the field was dominated by psychoanalysts, and there were some biological psychiatrists. There were very few general hospital psychiatrists, CL psychiatrists. And the research knowledge has also changed. Who would have guessed that the microbiome would loom important? Who would have guessed that we could be talking together right now via Zoom, that we could see our patients via Zoom? Who would have guessed that our country would be in virtual lockdown because of COVID? So all of these things are to say that we can't predict exactly where the field's going. A broad general knowledge of psychiatry, some appreciation for a life of wisdom and political art of getting things done will always be helpful. Pragmatism. And other than that, I look forward to seeing what's going to be out there 10 or 20 years from now, just as much as younger people do. We just don't know.
Joel, we thank you very much for joining us in this Zoom recorded encounter. We wish you all the best. Stay safe, be well, and look forward to seeing you in live meetings as the future comes ahead of us.
Thank you, Ted. This has been fun. Best of luck to you as well.